My name is Mariana Dume and I work at Rathgar Care Home. I am a senior carer. We have mostly dementia patients here. We do have a couple with capacity as well. Pain check is important in my role, and I think my colleagues will agree with this. It is helping identify the pain and the amount of pain your residents are in, and the pain they've experienced, and making sure you do give the right medication. And again, it's just having that documentation there to prove that what you've done was the right call to make if you have to call for other professionals. So we do have a huge responsibility looking after all of our residents. So each one of them do have different needs and they experience pain like different ways. It is important to know how to manage that pain, and it's important to know where to go if that pain is not managed properly. We used Pain Check for a lady here who experienced quite bad pain in her legs, and us doing the Pain Check daily, it showed the amount of pain this lady is in, and then in that way we could ring the doctors to ask for stronger painkillers. But also we used it for end-of-life patients. Using it daily, it shows you the amount of pain that resident is in, and if you have to call Marie Curie nurses, for example, to come and administer stronger painkillers to make sure that patient is comfortable and is pain-free. I feel that Pain Check does give us a lot of confidence. It helps you challenge people when needed. It is your evidence that obviously you have administered and why you have administered analgesics, because we don't want to over-medicate someone like with painkillers if they don't need it. So Pain Check is quite good for that, in showing us if the resident does experience the pain. It's good for people to use, to get in the habit of using it, again for your documentation and for the residents, because at the end of the day we're here for the residents and we want to make sure that we do everything we can to keep them comfortable and pain-free. We get lots of relatives asking about, is my mum in pain? Because I'll give one example, I won't give a name, but we have a lady here and the family used to give her painkillers at home every day, 2 times a day. Then she came here, and when we do our assessment, she never shows pain and she never complains of pain. So family said, well, we used to give her painkillers every day. But then we said, well, she's not really in pain. So I showed the family our Pain Check, and I showed her our assessments, which shows that clearly that their mums is not in pain. So there was no need for that medication. So we do get asked quite a lot, did my mum had painkillers, or my mum has complained of pain? Then we would do the Pain Check app, and that will show us if the resident is in pain or not, and then I can go back to the family. So we do get asked quite a lot about family, but obviously because they want their relatives to be comfortable, and I would be the same. So I would want my mum to be comfortable if she would be in care. So they just worry, and that's fine. You just we show them what we have, and then obviously if we need more input, we'll ask doctors and other professionals.